Okay. All right, we will call to order this meeting of the Dunn County Criminal Justice Collaborating Council Operations Committee, which is a combination of the operations and the executive group. And we are meeting via Zoom today. And so Sarah, do you just want to run through the roll?
Sure. We've got our new Judiciary and Law Committee Chair, Supervisor John Calabrese. And John, do you say Calabrese or Calabrese?
I say Calabrese,
Calabrese.
but I don't mind the other way.
Glad to have you join us.
Thank you.
We've got Chris Corpola. She's the chair of the CJCC and our Human Services Director. We've got Supervisor Kelly McCullough. He's our new County Board Chair. So welcome.
Thank you.
We've got District Attorney Andrea Nodolf. We've got Sheriff Kevin Bigd, and we've got Clerk of Court Katie Shalley. And then we're letting in Judge Meyer. And I will announce the others as they appear so we can be sure to match faces with names.
All right, so we will look at agenda item number 3, approval of the minutes from April 6th. I would entertain a motion to approve those minutes.
So moved, Kevin Bigd.
Kevin, second.
I'll second.
Second by Katie. Any discussion, additions, corrections? Otherwise, all those in favor of approving those minutes signify by saying aye.
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 Opposed, same sign. Motion carries. I don't believe that we have any public for public comment. So, Sarah, do you have a separate staff report, or do you want to just move into the kind of oversight?
I think we can move into the oversight. The only thing that I guess is not on the list is our CSEF grant. That's the Coronavirus Emergency Supplemental Funding. That's where we had funds earmarked for the sheriff's squad laptops and some safety features in the building. So there has been a change. IT informed us that the squads were not, these new laptops, they did not do the safety feature that's required for CJIS. So additional funding is needed for fingerprint readers. And then the portion of the LexisNexis software for the DA's office, that was paid out of last year's budget. So that cannot be reimbursed because it's out of your 2021 budget. We consulted with finance on that. So we're sitting with about $6,400 left on that grant after we were able to cover the additional fingerprint readers on those squads. So that right now we're just looking at getting digital evidence supplies for the DA's office to kind of handle and administer. That's, you know, Andrea, your estimate was about 2,500 as far as what you use in a year. So we definitely have ample funds if there's other things that we want to cover out of that coronavirus grant. So I'll just plant that seed.
And I would just note that, you know, sometimes I think with this group, with the CJCC, sometimes it's difficult to quantify what impact that there is. But in this particular grant, I happen to know, and Kevin, you probably know this number better than I do, but I happen to know because of some work we were doing on IT budget related yesterday, and Dan Dunbar showed us how he had credited the sheriff's department kind of savings account for future IT stuff. And I think, was it like $30,000 that this grant paid towards those laptops?
76,000 so far.
Oh, yeah. On the laptops?
Yes.
Oh, yeah. So that's a direct, I think that's a direct win or claim for having the right people at the table to be able to move quickly and be able to save direct county money.
Yep.
that was good.
Absolutely. So I think that's the only, I guess, additional staff report that I'll add at this point, and we're going to be talking about a lot of other updates here in a few minutes.
So typically I don't like these meetings just to be report out, but there are a lot of small but moving pieces that the different stakeholders in the CJCC are a part of, and we thought it would be helpful. This is the oversight committee to a number of activities that are occurring, and we thought it would be helpful. And then having Supervisor Calabrese and Chair McCullough be here, this is a good opportunity to just do some of those updates on some of those things that are happening as well. So Sarah, I will turn it over to you and loop whoever you need into as you go.
All right. Well, the first on the list is our drug endangered children team. So we met here not too long ago. And Andrea, I'll turn it over for you in a minute, but really trying to regroup. We've been waiting for the drug investigators to get back trained and back in action. So we were able to pull a meeting together in April and really kind of regroup and refocus. And we want to spend some time really putting an event together to really bring it across our staff across different agencies to really with the purpose of that relationship building, but then also learning about the drug endangered children. So Andrea, I'm going to just turn it over for you to get a little update on deck.
Sure. So we're working on a number of projects, but yeah, I think the first one and our primary one is to try to have a networking type event. I think due to COVID and turnover in both human services as well as law enforcement, that's something that's kind of lacking. And through my experience in this, it kind of all boils down to relationships and having a new officer think, okay, yep, I just made contact with someone who's under the influence or has meth, and trying to do some follow-up to ensure that any kids involved, as if these are parents or if kids are present in the home, to call human services and work together to try to bring forward the best case to ensure both, children are protected and getting the services they needed, and as well as, changes are being made for the parents who are using. And so that's something we're working on. It's been difficult with COVID, I guess, but we're hoping to put together some sort of like summer cookout in the back of human services outside, just to try to have that networking and put a face to a name. And then also, I think human services is working on getting a card for an access report. So when like a teacher or someone in the community notices that, a child may be needed of protection and services, or, was a witness to a domestic assault, or, if for example, a school teacher sees something at school that's concerning, there's certain facts that are needed in order to make a good report. And so our hope is to try to just have a little like laminated card to distribute to those kind of frequent people who make those reports to try to make a more effective access report. And then also is just trying to establish working together. I think due to turnover, both the Menominee Police Department and the Sheriff's Office is supposed to have a dedicated drug investigator. And I think due to, turnover, there's been that position lacking. And so there's now 2 investigators in that spot. And so trying to get them active in the group and ensuring that they're having kind of like those deck meetings where we go through cases and see what we can do better. And one of the things we've been focusing on too is forensic interviews. And so when a child is a witness or a victim to something traumatic, like a sexual assault or a witness to drugs, they're sometimes interviewed at the Child Advocacy Center in Eau Claire. And there's been a lot of turnover there as well as I think they at this point don't even have a full-time staff at the Advocacy Center. So we've had to restructure to interviewing children downstairs in the Menominee Police Department or Sheriff's Office. And so just ensuring that we're taking all the steps necessary to ensure that a child is, having the least, I don't know, trying to make it so it's a safe and less intrusive event for them as possible. So those are all things that we're working on.
Cool, thank you. Those are, I love the idea of the card. I know that we've worked hand in hand with some reporters sometimes when we know that they're really passionate about believing a child needs help, but they just don't have the right information, and trying to kind of coach them through how to, without compromising the report, how to get the right information into the right hands in order for something to happen. So I think that's a great idea. Sarah, MPD and COSUP.
All right, Chief Atkinson is not here, but I can give a brief update. So this is the multi-year, multi-pillared grant that the Menominee Police Department received. Chief has been working to really take it from plan to actionable. And one part of the plan is a quick response team, where a small team led by law enforcement, a fire medic, and then a helper person, whether that's human services or other type, or someone from treatment, but really target the people in the community that are most at risk for a fatal overdose. This is a law enforcement led effort. These are very successful across the country and really came out of the opioid epidemic, where when law enforcement kind of does that, the ask that, we see you struggling, we think you need treatment, that about half the people take them up on the offer. So it's one of the areas that Chief is really looking to see if we can deflect some people out of the system by really addressing them and getting them connected with treatment immediately. So that has been ongoing. There's been different QRT meetings really focused on that hands-on team, but then there's also some executive planning and really coming together meetings that have been going on. So really it's really bringing together law enforcement, treatment, human services to the table to really talk about what we can do from all angles to really address the substance use problems that we see out in the community. So I think that's going ahead just fine. The intent is to be really small as far as who they're targeting, really those most that are at risk. And they hope to start their deployments in July. So we'll keep you posted on the progress of that.
I think also worth noting is that fairly quickly after we sort of get our legs underneath us in that project, we hope to be able to expand it to a bit to some of our frequent users of crisis, mental health crisis, and or not necessarily that they're even accessing our crisis system, but that are repeatedly showing up because they have significant mental health issues. So we have a fair number of them who we're looking for some means to try to loop them into treatment earlier. And I would say that it's another spot where, so the model for this that's been utilized in other places has used your fire department emergency response folks. And so it's another spot where, we are all serving the same people, sometimes repeatedly, and now we have an avenue to bring them to the table and something that we can do that's collaborative and work together and try to lessen all of our workload and increase our reach, our impact. So I think it's just another indication, another piece of evidence of where we're just trying to work smarter. That's strategies.
All right. And at any point, if anybody has any questions, feel free to ask. So we have our newer team, the effective meth strategies. group that has met and really is using a framework to really look at the scope of the challenges. So there was a document that was shared. It was really strategies in tackling methamphetamine, but it really kind of has those 4 pillars of prevention, treatment, enforcement, and harm reduction. So we're kind of using that as just a framework to kind of to tackle the challenges when we're looking at methamphetamine. We really want to do something different and effective that will kind of lessen the amount of people that are coming in the criminal justice system due to meth. So at this point, we are starting with the focus on prevention. So our next meeting is going to be on June 1st at 3:30, and we'll be hearing from Menominee Police Department and what they're doing right now for prevention. We hope to hear from our sheriff's office and hear what they're doing on the area of prevention. And then we've invited Arbor Place, the prevention coordinator, to join us as well and to hear what they're doing for prevention. So we just kind of start with the basics there, and then we're gonna build from that. Chris, you're co-chair of that group. Anything that you'd like to add?
Another thing I would say is that I think that group somewhat recognizes that while it's really tempting to try to start at the deep end, we're not as likely to make much impact because there really aren't. It's not that we don't have any strategies looking at the deep end side of it, but there are not great treatment outcomes for persons who have methamphetamine addiction. It doesn't mean we don't stop. It doesn't mean we stop trying, but we recognize that part of what we need to put some effort into is stemming the flow from upstream. And so it leads us to more of that early intervention and prevention work. Treatment court multi-track training.
All right. The treatment teams, both the adult treatment court and our family treatment court, are just on the heels of our state training. So we had the opportunity to send teams down. Part of the teams were virtual due to some illnesses and exposures, but for the most part, we were able to really get together to learn. This is a state conference that is offered every year. And treatment teams across the state come and learn really best practices and standards for operating. These really are the most effective way to deal with drug addiction in the criminal justice system. And it's important that we are true to the model if we really want the outcomes. So it's an important component to our treatment courts really getting that annual training. But in August, we are going to be taking part in national training with the National Association of Drug Court Professionals on multi-tracks. So really looking at serving additional substances or additional risk. Right now, treatment court in its purity is really focused on high risk to recidivate and high needs, meaning treatment and other needs to really for them to make any changes. So we had the commitment by the team that they will participate. So that includes the district attorney's office, the sheriff's office, Menominee Police, and certainly criminal justice staff here and our judges and probation to attend this training and really get that specialized assistance in looking at multiple tracks. So we are doing monthly training to ensure we're meeting all the basic requirements of this, and then really hope to have potential plans for reaching other populations. Right now, our treatment court is, probably 95% methamphetamine use disorder, where we see a lot of folks come in to our criminal justice system where alcohol is the driving issue, or other drugs, or we see people that are at a lesser risk. So this will help us explore if we're really targeting the right population with our treatment court, or if we want to pivot or add. But we do have that multi-system team committed to the training. Any questions on that?
And that's in August, Sarah?
Yep, that's in August, yes.
Nice. MAT in jail.
All right, MAT in jail. So we, the grant for $150,000 to bring treatment into the jail is working its way through the county board committees. Admin approved it at their last meeting, so it'll be on the executive agenda later today, and it'll be hopefully moving to the county board agenda for next week. So that'll be that formal acceptance where we can have those funds added to our budget and start spending it. In the meantime, we have been holding meetings in the jail with our jail captain and reentry program director staff and the jail medical staff as well with the Vivitrol reps. So that's the medication assisted treatment for opioid or alcohol use disorders. So we've already been kind of hitting the ground running with the Vivitrol piece. The other parts will be coming along where we're going to do some contracts to get groups, that cognitive therapy groups going in jail. So that'll be coming down the road after we get our Vivitrol piece going. We've also been having state meetings with the grant. So there's a couple other sites out there that receive this grant. So it's nice that we can meet once a month with the State Department of Justice, but they also have a medical advisor that is an addictionologist from the University of Madison that's on that team. So we really have just that expertise right at our fingertips. So that's been moving ahead. I don't know if Sheriff wants to add anything to that update.
No, it's just a good opportunity. I think there was 3 counties in the state that were awarded this grant. Who was it? Sarah? Wood County, us, and
I think Fond du Lac?
Fond du Lac, maybe.
Maybe.
Yeah. So it's a good opportunity to bring, medication or medical assisted treatment into the jail facility for those that need it. We don't have a high heroin problem here as much as it is 20 miles away in Eau Claire. But we certainly have them come through my facility that this would benefit. So it's a good opportunity to use some of the state funding to provide that, because the shots are like $1,200, $1,500 a piece. And it's just not something that we can put on the backs of the taxpayers to pay for that. So it's a good opportunity to use state funds to provide that treatment.
Absolutely.
Absolutely. Ted and Top.
All right, so our treatment alternatives and diversion grant from the state is what we use to fund our treatment opportunity program. So we have a state visit tomorrow. Department of Justice is coming up to do a site visit on our TAD funded TOP program. And they also asked me to be a co-chair of the state CJCC TAD subcommittee, which I accepted. So that's led by State Public Defender Kelly Thompson. So I will be joining her as co-chair of that group. And they really sought us out because we've got one of the better programs in the state, and we're really adhering to the standards in that realm. So one of our, just an example of really how putting our efforts together and trying to do something that really meets the standards can get some better outcomes. So we have some prep work that we're doing this week. So Andrea, thank you for your assistance and your staff's assistance. And then we'll report back on the outcome, but really there's we have all the standards in place for our top program. So again, that just shows that we're doing things as we should be doing them. Any updates on TAD or TOP? I guess I will just note that there'll be another solicitation coming out next year, for probably later this year to start next year, for additional state dollars that are going towards the treatment alternatives and diversion. So we'll, as being part of that state subcommittee, I get to help kind of formulate how those funds will be kind of earmarked and utilized. So it does gives us, kind of that insider advantage as well, kind of knowing what they're expecting and knowing what they want and being part of that decision-making process as well.
And didn't you, Sarah, did you say this? If I missed it, if you did, didn't you have a site visit this week? Or
They're
didn't you have
coming, No, coming next week.
coming next week.
Yeah.
We just happened to, Judge Meyer and I happened to sit with Mike Durr from the TAD, and I didn't know him, but I knew him. I didn't know his face, but we knew each other after we realized that we'd worked in some other programs together. So yeah,
Okay.
he said he was
great.
coming to
Yes,
Dunn
he will
County.
be Here on Tuesday.
Nice.
Yeah.
All right.
I have a quick question, if I may.
Yes, please.
Yeah, and this might just be an obvious thing, but I'm just wondering in terms of the sheriff talked about those shots and the treatments for the addiction and obviously certain inmates and people are further along with their addiction than others. And so I'm wondering, or deeper into it, or whatever the terminology is, I'm wondering who decides who gets who needs one of those shots and who doesn't. And I'm just wondering in general at the jail, are there medical professionals on staff there all the time, or how does that work?
Yeah, we have a staff nurse, not 24 hours a day, but she's here, 5 days a week, Monday through Friday. And then we have through ACH is her medical contract. So she reports to her medical control, a doctor that would have to sign off on anybody that wants to volunteer to receive those doses and proceed through treatment that way. It's kind of it starts in the jail. It's really, they get a shot about a month before they leave, or within the last month they're in the facility, and then it turns into, follow-up treatment and stuff after they leave the facility. So it's just kind of a starter boost for them to help them prevent the urge to use again once they leave the facility. Because honestly, when they're in my facility for 6 months to a year, it's probably the longest stint of sobriety they've had, in years before going there. And we want to continue that sobriety once they leave the facility. So.
I see. Yeah, that makes sense. Thank you.
And I would just add that there will be an assessment that will be done, that there's a treatment need, and that will be one of the referral mechanisms to the jail medical staff. And then they'll also take part, they won't just get the medication, but it's coupled with cognitive behavioral groups, or, starting to change the thinking around addiction. But the medication is highly effective. And as Sheriff mentioned, when people go from a long period of sobriety, and if they go back out to use, when we're talking about opioids, they use at the same level that they did before they're at really high risk of overdose. That's a small portion of our jail population, but there's other drugs that medications can help to really just calm the cravings and really allow that cognitive or that treatment piece to start working. So the best outcome is when both of those are together, and and it's important for the opioid population that they get that shot while they're not using. Otherwise that can be problematic. So as Sheriff mentioned, about a month or so before discharge, they'll would start that medication treatment.
All right.
I'm just letting in Judge Peterson, add him to our list.
Okay. I can tackle housing. There really are two things that are happening in the housing world. One of them is that after the long talked about Dunn County housing study, that is finally moving forward. It's a partnership with seed money from the Community Foundation and CDBG to partner with West Central Regional Planning to do a comprehensive housing study for the county. The city of Menominee is doing an kind of an adjunct one, as well as the village of Boyceville, that will go along kind of hand in hand with what the countywide one. But as in all things government, CDBG is the most governmental of anything I've ever known. And so we were all set to go last month with our launch, and we didn't have a contract in hand, and you can't start activities till you have a contract in hand. So we officially have a contract in hand now, and we will do a launch of the advisory committee for that group. Will meet the first week in June. And regional planning will be moving forward with some focus groups, some forums, some surveys. They have a whole plan for how to pull this off with the goal of being done by the end of the year. So that's a good thing. It'll give us some really solid information about where things stand in our county with regard to housing. And then the other thing is we also have our large CDBG grant that does two things. It well, it does more than two things, but the two things related to the CJCC are it provides emergency housing money to stepping stones when they have not been able to operate a congregate shelter. And so it pays for hotel housing for persons who are homeless. And it also, then the goal is to get people moved as quickly as we can from emergency sheltering into a more transitional sheltering arrangement. So we have had for the last year, basically they opened, I think, a year ago in May. So we're a year old, have two transition houses, one for men and one for women. Men is 5 beds, women is 6 beds, have been up and running. They have a case management component. They are not sober living. Which would sort of be an adjunct to treatment kind of need for people, but they are a stable living situation. And then we were able to request additional money, and now over the next month or so, in our partnership with West Cap, they will open 2 additional transition houses, and I believe we decided they're opening them for all, did we say men or women? Men. We're going to open the next 2 for, I think, for men, because that was where the highest need was. Yeah, so they are up and running. It's been I think a steep learning curve into how to do this work, with trying to tackle the obstacles that are run hand in hand with people that have, I think every person in our transitional situations has criminal history, mental health issues, and substance use issues. And they create a complicated trifecta for trying to get people transitioned to permanent housing.
I would also add that Onyx House is sober living, and they have just opened their second house in Menominee. And that's a private company, but they do require sobriety and have in-house programming. So it is a step on the continuum from transition to sober living. And some of the challenges with the transition house have been there's very few places for those folks to go. There's, I think, just very few have actually been moved into permanent, housing outside of the transition house. There's just a lack of affordable, safe housing, for people that have a criminal record or have mental health issues that are known.
Our kind of loosely titled advisory group for that's just really the key stakeholders in that project. We're due to meet here now again. We haven't met for a couple of months, but I believe the last time, or close to a couple of months, the last time that we met, Stepping Stones had 50 people on a wait list for emergency housing, or 50 households on a wait list. So some of them are more than one person for emergency housing. I've shared this before, but I know probably about last summer, about a year ago, and the situation hasn't gotten any better. Heidi Hooten from Stepping Stones related that there was a house available for rent at a relatively reasonable price. I believe it was $900 a month, which is still out of the range of many people, but they had 100 people who looked at it. So there's housing is a huge challenge, but it's not just in our community, it's everywhere. But hopefully the housing study will help us to identify some strategies that we can undertake to try to resolve some of those things. Questions about that?
So
All right.
question, actually, if we can go back to the medical assisted treatment in the jail. Just to clarify, are we providing medical assisted treatment to those with strictly methamphetamine addiction, or is it just, my understanding is, it's just alcohol and opiates and mental health? Is that correct?
Yeah, it is. Unfortunately, there is no medication assisted treatment for methamphetamine. There are some pilots out there that are promising, but there's nothing really clearly effective. So, you know, there was potential to kind of do some piloting, but I think it would have to be, we'd have to really understand more with the medical doctor as well, what he's comfortable doing, because this would be outside of the scope. They said, you know, if there's an underlying alcohol or opioid use, if it's co-occurring, you know, and if they've got multi-substance use, you can treat those. And, you know, to be honest, most of our people are multi-substance users. If they don't have one drug, they're seeking out another drug. So that could be a group that, but they would have to have that particular addiction to alcohol or opioids in order to get that medication, the Vivitrol anyways.
Which would include fentanyl, which is on the rise right now as well. And fentanyl seems to be being laced into the methamphetamines in the area and the marijuana in the area and everything else. So fentanyl is a synthetic type of opioid.
Any other questions? All right, the Battered Women's Project and firearms surrender mapping.
All right, so I was just contacted yesterday by this, that's the Women's Battered Project. Nicole, I think her name was, she and her team presented at our last meeting, and we had an action that we approved to take part in this technical assistance to help us map out the domestic violence and the firearm surrender, help us really develop a process for identifying and really internally knowing when there's a firearm surrender. We were just one of 4 communities that was selected to take part in this. So this is something that came to us through Chief Atkinson. So I am going to be meeting with her next week to start coordination. But we did commit, if you recall, to a convening and getting together. So we'll learn a lot more about this process and really those key individuals that need to be at the table. But I would assume it would definitely be the courts, the judges and the DA, all of our familiar faces here. But I will keep you posted as we move forward on that project. Any questions right now on that? I probably can't answer them anyways, because I know as much as you guys know.
All right, and the last thing on our list is the elder abuse training grant for the ADRC with the ADRC. Again, we had a presentation or a request last month from Tracy Fisher, the ADRC manager, who had been approached by the DOJ to throw our hat in the ring to do some specialized training with law enforcement and DHS staff around elder abuse investigating. And so thank you to all of you who in a very timely manner provided Tracy what she needed to get to the Department of Justice for them to be able to request the funding that would allow us to have this kind of technical assistance available to us. So haven't heard more about that. Here I'm in the dark again. Haven't heard more about that. But everything, I know everything was submitted and the letters of support that you did and your endorsement of that project are helpful. I would just note that, and I don't know if Tracy said this, but Well, our elder abuse and vulnerable adults, adult protective service and elder protective service reports have been somewhat stable, more stable over the last 3 years. They did take a relatively precipitous rise in the years before that, and we do about 180 adult protective services investigations a year. So providing some additional resource to that group, I think will be really helpful. All right, that leads us to through the kind of the things that are currently happening. Does anyone have any additional questions or comments about things related to moving pieces with the CJCC? Oh, I would note Sarah and I and our family treatment court coordinator and our the family and children services manager involved in family treatment court met yesterday regarding a federal grant opportunity for treatment court expansion projects. It'd be $820,000, up to $820,000 over a 3-year period. And so we looked at a number of areas of potential things that we could do related to treatment services for kids that have been drug. We already know that little kiddos that are coming out of or that are involved in homes where there's a substance use issue are already at elevated risk of developing a substance use issue of their own, both genetically and environmentally, and trauma based. And so we'd like to provide some additional services to those kiddos. We talked about doing some potential partnership with public health regarding nurse family partnership and home visiting for babies, expanding peer support, doing some cross systems training, and then yeah, looking at doing some, we have a family treatment court graduate who's continued to do extremely well and is very interested in doing some additional support type work to current participants, future participants. And so if we can figure out a way to bring her on board to be able to do that and make that a viable living for her, we think we'd have a great resource in that. So so anyway, we're going to throw, Sarah's going to take the lead in starting to pull that together, and we will use the process that we've used over time and kind of have a number of collaborators on writing the grant and try to get it out and see what we can bring back. I think that that's all that we have. So typically we have spent some time talking about local challenges or emerging trends. Unless someone that has earth-shattering something to do, we mostly wanted to provide an opportunity, just bring you up to speed on all of these things. We would happily give you back 15 minutes of your life if you have nothing that's earth-shattering that you want to bring forward at this point in time.
I'd mentioned that Dan Westland's back to work and assigned to the drug investigator position. So he and Wade from Menominee Police Department are kind of getting on the same page and starting to work cases again now. After our transition from our former investigator went back to patrol, Dan's picking up and running with some cases and starting to develop some more local cases again. So.
And he was a drug investigator previously, right?
With Menominee Police Department. I stole him from Menominee Police Department. Yep. And he was a patrol officer for me for about a year. I put him in an investigator position, and then he agreed to take the drug investigator assignment for me. He worked with Menominee Police Department as a drug investigator for about 5 years. So he's got good experience in the area.
Andrea, you had an ADA pilfered, right? By St. Croix County?
Yeah, St. Croix County Corp Council. So yeah, we're short staffed. I have 0 applicants. So there's openings all over across the state, and usually, you know, the going rate, I think even in Dunn County Corp Councils, like starting at 80,000 and starting here is 55. So I anticipate I won't be receiving many applications, if any.
Go to
But,
law school, incur hundreds of $1,000s of debt and come to work for us for $55,000 a year.
Right. Can make more at Anderson Windows. So
Yeah.
Yeah.
So you have 2 or 3 ADAs currently,
3.
3 and then 1 position open.
Yeah.
Or does that include that open position?
No, there's supposed to be 4.
You're supposed to
And
be
so
4. Okay. And what kind of a crunch does that put on your office?
It just makes us busier, I guess. So I've taken over the sexual assault cases. And I'm busy getting ready for the homicide trials too. So it's just means we're on intake a little bit more frequently, but you know, we used to only have 3, so we're doing okay.
All right. And then how about the judicial transfer? We're coming up on what we must have been 9 months into this with 3 judges. Either of the 2 of you, Judge Peterson or Judge Meyer, care to comment about?
I think things are going really well. I don't know, I'll let Chris chime in on that, but I think new judges are kind of hit their stride, and things are working out real well, I think, right now.
I think things are going well too. I think that, you know, it takes a while to learn and set up things how you want them or whatever that is. And so I don't think the learning process is done, but certainly it's 9 months in.
Absolutely. Absolutely. Cool. Well, I'm assuming, Judge Peterson, that you've noted some reduction in your workload.
Oh, yeah. Yeah, it's intake is much more, how should I say, doable. It was really a grind, and it's still a grind, I think, when you're on intake, and Judge Wagner's on intake this week, and I start 2 weeks, but having 2 weeks or 4 weeks between intake cycles really helps a lot. You know, there's time to, you know, do some, you know, research and more time to prepare, and the frequency of our hearings is a little bit less during intake, which helps. So all around it's been good. So it's been a long time in coming, and so I think it's really going to provide us an opportunity to provide a better product for the customer and people that use the court system and so on. So, and I don't know, what do you think, Katie? Throw it over your way.
Yeah, no, I think it's going really well. Definitely. You can tell that the caseloads are evened out, and it's not as much of a grind. We used to always have to fight to get hearings scheduled before the judges, and there's a lot more time. It always depends on if there's vacation or what's going on jury trials wise, but I think the public has a lot more accessibility to the courts in a much more timelier manner than what they used to have.
And how is the gig as the county board chair?
I'm very much still at the ingesting massive amounts of information and working on synthesis stage of things. I figure in about something between 6 weeks and 6 months, I'll start to get around to the drawing conclusion stage, but it's very much intake right now.
I'm sure your brain goes to bed tired.
Yeah, especially since my day job is similarly challenging.
Right. And welcome aboard, John. I'm glad that you're taking on this.
Thank you.
Yeah, I really appreciate that as well.
Yes, I appreciate everybody being so willing to be patient.
All right, our next operations committee meeting is set for June 1st. We have a meth strategies meeting that same day. The executive committee so we can set the agenda for the next CJC meeting, we'll meet in early July, and then the CJCC will meet on July 14th. So those meetings are on the agenda. Get to have on your calendar. And I didn't quite give you 15 minutes, but you got a solid 8 that you can pee and have a bite to eat. See you guys in a month.
Thank you. Have a good day.
Bye-bye.
Thanks, everybody. Bye-bye.
And thank